pandemic began to 318,122. Over the past couple of weeks, the rolling average that we've seen has actually decreased by about 66%, according to Johns Hopkins University data. We also did see more than 24 new hospitalizations yesterday, but despite that big number, our numbers are moving in the right direction in terms of hospitalizations. A total of 522 people are currently battling COVID-19 in the hospital right now. But keep in mind, exactly a month ago today, that number was approaching 1,100. That is more than double today's number. Active cases went up on Thursday by 44 to just over 4,700. 10 more people died in the past day, bringing our total number of deaths in Arkansas to 5,397. Our first case was announced here on March 11th, and that's when the governor took action. So his announcement this morning is coming as this public health emergency that he announced on March 11th is set to expire. So that's what we're going to probably be hearing from the governor today. Arkansas reported its first COVID case that day. It's scheduled to expire tomorrow, but the governor has indicated that he is planning on extending that today, but hopefully we'll hear whether he's going to do that or not. The governor has renewed the public health emergency multiple times. It's intended to facilitate with the coordination of the state's response to COVID-19 and provide extra support for state agencies responding to the pandemic. So we're going to have to wait and see if that is part of his big announcement today. Normally we hear from him every Tuesday, so it's interesting we're hearing from him here on this Friday morning. But Arkansas, you know, is ramping up its vaccination efforts. The state has given out more than 578,000 doses to people across the state. The CDC is reporting that 68 million shots have been given to Americans across the country. Again, 3,000 more needles are going to be going into people's arms today at that mass vaccination clinic in Lowell, where the governor is about to speak. And one of our employees here just drove past there and said the line is already so long. It started at 9 this morning. So hopefully we'll be hearing from the governor here. He said he was going to be speaking today at 9 this morning. So you're taking a look right now at the Moderna vaccine, which is one of the vaccines that's going to be administered. Or is the vaccine being administered there today in Lowell. And the people who are lining up there, they did have to make appointments in advance. So we have those details on our website, 5newsonline.com. But just to recap for you, our numbers have gone down significantly. So here's a look at those numbers yet again. 726 new cases reported on Thursday. You can see since our first case was announced on March 11th, 318,122 people have been diagnosed with the virus in the state. So it's a big number, but it's encouraging to see that our numbers are going down. I think the governor is about to speak, so let's go ahead and listen in on what he has to say.
Thank you for joining me for this discussion today and the announcements pertaining to the current state of emergency and the pandemic in Arkansas related to COVID-19. I'm joined today by Secretary Romero, of course, of the Department of Health, as well as Dr. Ivy Pfeffer of the Department of Education. And as many of you know, the current public health emergency declaration expires on February 27, which is tomorrow. And I waited to evaluate where we are on the cases before making a decision on whether this current state of emergency should be extended, and obviously in consultation with our Secretary of Health. And so today I'm announcing that I am extending the public health emergency for another 30 days until March 31. And this, I would emphasize, includes very important executive orders that allow us to have Medicaid reimbursement for telehealth. It allows business liability protection, remote learning, as well as other orders that have been necessary during this pandemic that the legislature is currently trying to put in bill form and into legislation. But that has not been accomplished yet, and so that is a part of the order that I'm signing today, the proclamation extending the health emergency. The reason that we are making this announcement today on the continuation of the emergency is that it is necessary because we need to have these items still in place, but we've also made progress. And if you look at the first graph, we can just remind ourselves as what public behavior has done in terms of the progress on our cases, reducing the number of cases, and the trend line that we have established. Nothing is guaranteed for the future, but while we're still in an emergency, we have made progress. Progress is, in addition to the reduced number of cases each day, we also have progress on our vaccination front with our efforts continuing, but we've seen vaccinations reach out to our nursing homes and the elderly getting their vaccines as well. Teachers have had access to vaccines, and even though there's much more to do, we are on the right path. Hospitalizations are down, positivity rate is below 10%, vaccinations are increasing, and compliance with public health guidelines is at an all-time high. And so based upon the progress, based upon the statistics that we have, the proclamation that I just have issued also includes a directive that the mask mandate will continue, but it will end on March 31 if certain public health goals are maintained. And if we look at the graph that I've presented, you can see that we've set specific criteria that is important to know how we move out of this pandemic and to a more normal life. And so if we can achieve a positivity rate of 10% or less, both PCR and antigen positivity rate, with at least 7,500 testing specimens on average daily, then March 31st, we can move away from the mask mandate and it would become simply a guideline. And then the other, you might say, well, we might not be testing at that level. And so the second point is that if testing is below 7,500 on an average, then we'll look at the number of hospitalized patients based upon COVID. And if that's fewer than 750 hospitalized statewide for COVID-19, then we can use that as a trigger as well. And so it will stay in place through March 31st, but we have an opportunity to see where our progress is, and if we meet these benchmarks, then the mask mandate will be lifted on March 31st. In addition to that being a part of the proclamation, I have another announcement which is effective immediately. All other public health directives that have been issued will be converted to public health guidelines. And let me show you the difference, first of all, between a directive and guidance. A directive is based on scientific data and a rational basis, is a mandate like an order with a potential penalty after due process. Everybody's familiar with that. A guidance is based on scientific data in the same way is a strong recommendation based upon medical consensus. And so we are moving from directives to guidance, and the examples of where this would make a difference would be in restaurants, gyms, salons, indoor venues, and outdoor venues will be subject to the same guidance that we've had in the form of directives, but it will be guidance. The reasons for this, as I've stated, we've made progress in the pandemic. Businesses have adjusted and made changes to their business model in the interest of public health, and we've seen a steady decline in cases. Also, we've had increased public education, so the public knows exactly what is needed to stop the spread of the virus. They know where they can go safely, where they can't go safely, and they can make those judgments. And then the public needs to understand how we move out of this pandemic and into a more normal life. We're outlining how we get there. We don't get there immediately, but we get there through following guidelines. We get there through seeing the cases go down and continuing to be careful about our behavior. Let me emphasize that because we're changing these directives to guidelines does not mean that you're going to see a change in behavior, and I do not expect to see a change in behavior. For example, in state government, we will be telling our departments of government that they need to continue to follow the distancing, the social distancing guidelines. We need to continue to follow the wearing of masks when you cannot social distance. In terms of our businesses, they are incentivized to follow the guidelines because that gives them business liability protection. Because the business liability protection is based upon following public health guidelines and making a good faith effort to make sure everyone is safe in their employment. So they are incentivized, and so it does not mean a change in behavior that you will see. It does allow for some flexibility in indoor venue events, outdoors. There's more flexibility. If the guideline doesn't make sense, we can work with the Department of Health, and if they seek that guidance and keeping the public health in mind, there is a little bit more flexibility. You might ask the question, well, what if cases go up? First of all, the fact that we are changing directives to guidelines does not change the necessity of quarantines and isolation, and those directives are still in place. Those are part of the emergency order, and that is part of the essential work of the Department of Health. But if the cases go up, I would remind everybody that the emergency order remains in place. And so we can adjust as needed. The mask mandate remains in place through March 31st, so we have an opportunity to continue to watch where the cases go over that period of time. And then if we see a dramatic change or necessity based upon where we are with the virus, then the guidelines can be reinstated as mandates during the continuation of the emergency. And so those are three important announcements I wanted to make today. The continuation of the emergency, the mask mandate continues through March 31st with an opportunity for that to end if we meet certain public health criteria in beating the virus, and then our public health directives become guidelines. We don't expect a change in behavior, but we expect people to keep their nose to the grindstone so that we can get through this and back to a more normal life, but it paints a picture as to how we can get there. And with that, Dr. Romero, I invite you for your comments.
Thank you, Governor. Thank you, citizens. So our change today is based on the fact that we have shown significant progress with regard to number of cases and number of hospitalizations. I think we have a robust system in place to continue to monitor carefully. The health department has built a robust testing system that will allow us to track and to follow these cases should they occur. I think that what merits bearing in mind, as is stated by the governor, that this does not change, that should not change the behavior of the citizens of Arkansas. That is that we will still need to wear our masks, maintain social distancing, wash our hands. Those are going to be essential in keeping this pandemic affecting our state under control. A variable that has been entered into this equation has been the variants. We are watching carefully for them. Because we have not found them does not mean they are not here. Those variants spread more easily, and depending on the study, anywhere from 30 to 50 to 70% more efficiently, and therefore can spread more quickly. They also have, at least one of them, may have a higher rate of mortality, morbidity than the current strain. So we're going to be watching that very carefully. These changes have triggers in place that allow us to advise the governor regarding the need to re-escalate based on what we're seeing, and one of them is, of course, the CDC recommendation that testing positivity be below 10%. That will allow us to pivot if necessary, and we have a fallback, which is if we're not testing, which I hope we will still continue to be testing, use our hospitalization rates. I want to stress the importance that this does not mean that we should not be advocating and encouraging all individuals to accept the coronavirus, the COVID-19 vaccine. It is essential that we all receive the vaccine. That is the only way we're going to move out of this epidemic, of this pandemic. We need to protect ourselves and protect others with these vaccines. But I think that at the moment, that given where we are today, the steps put in place are practical and can be monitored carefully. So I'll turn it back over to the Governor. Thank you, Governor.
And let me do the last slide there, if I can, because one question will come up in reference to schools and the impact on school districts, and Dr. Pfeffer is here to work through this as well. But most districts have adopted local board policies to require mask mandate and social distances. This will remain in place at the discretion of local boards. Of course, the mask mandate as an overall will stay in place at least through March 31st. The guidance on capacity and social distancing will allow for proms, athletic events, graduation, other extracurricular activities to be held. Quarantine guidance will not change, and the identification of close contacts will stay in place. I know there'll be a lot of questions on the education side that they'll be working with both the Department of Health and the Department of Education to answer any questions that might come up. With that, we'll be happy to take questions this morning.
So if you still want people to follow the guidance, what's the benefit of making it voluntary as opposed to mandatory?
For the reasons that I stated, you can't keep directives in place forever, where you have penalties, where you have enforcement, and you also have the temptations for citizens to be reporting on each other. And so as I said, you can't have them in place forever. And at some point, we have to move away from those directives. And this gives us a safe path to move forward following the guidelines. And if a business believes that they can keep their customers safe and their employees safe, and they want to tweak it because the guidelines don't perfectly fit with their business, then there's more flexibility with the guidelines versus the directives. And there's not the enforcement and the potential for a fine.
You say you don't expect this to change behavior, but what if it does change behavior and now people don't have a way to report or enforce, these really important safety measures?
Great question. And if behavior changes and results in a increased spread of the virus, then we're going to know that by the increased number of cases, the increase in the positivity rate, and very likely an increase in hospitalizations. And so we're able to monitor that, and for that reason, the emergency stays in place, the mask mandate stays in place for a time. And if citizen behavior does not protect us from the spread of the virus, then we might have to re-engage with additional public health measures.
Now it's not related to the measures in the legislature that are, would curtail the emergency powers.
What triggered this announcement today is the fact that the current emergency expires tomorrow. And so I had to make a decision, and obviously legislative input has been valuable, and I hear what they say, but it is based upon simply the fact that the current emergency is expiring, and then secondly, the progress that we have made very dramatically in the last 2 or 3 weeks indicates that we can safely make these adjustments.
Has said several times that we're watching for these variants, but that you said you suspect that they are here. So does that not give you pause to start loosening restrictions at a time where a variant could come in and undo all this progress?
It is a factor. I suspect that the variant is here in Arkansas. We just have not detected it yet. I recognize that's a possibility. It could be detected tomorrow. I've also watched other states that have the variant in place, and their cases continue to come down as well. And so that is a factor. We'll have to watch it. If we detect it, that doesn't automatically mean that all of the announcements I've made today are off. It just simply means that we've got to continue to watch our behavior and hopefully keep us on the same trend line. Are there any questions remotely? We have a little bit of time this morning.
Governor,
yes. Governor, good afternoon. It's Neil Gleider at Hot Springs. And I have two questions, one on vaccines, if you have any idea about when 1B will be fully opened. And then what does this mean to restaurants and bars if the legislature, in essence, refunds fines? Does it encourage restaurants and bars to say, okay, I can go back to 100% because there's no financial penalty?
Well, I mean, first of all, I hope the legislature will reconsider their movement to refund fines. That has been very fair. If that was made into law, that would undermine our public health directives, our enforcement efforts. It would undermine confidence by the public. And so I would hope that does not become law, and if it gets to my desk, I would not sign it into law. The rest of your question is what incentives does bars and restaurants have? And as I said before, they have been provided business liability protection during this pandemic if they follow the public health guidelines and they act in good faith on that. And so there is an incentive for that good behavior and for following the guidelines and protecting the customers. Obviously, it gives them some more flexibility and they're not going to be subject to penalties, but they still have the incentive to do what is right because consumers can make good judgments as to where they want to go and where it's safe. And secondly, it does give them a better opportunity for liability protection. Next question.
On the 1B, though, Governor?
Go ahead.
On when do you think 1B will be fully open?
Oh, I'm sorry. Neil, 1B, we look at, we've lowered it now to 65. We want to make some progress on that before we open it up to additional categories. So we'll monitor it, but I cannot give you a time frame at this point when we'd open up to other categories. Perhaps next week we can give a better estimation of that. Next question.
Governor, this is KNWA in Northwest Arkansas. My question is in regard to the school districts being able to keep a mask mandate in place if the school board so chooses. We have seen evidence in other states like Georgia where allowing each school board and school district to make that determination themselves have led to vast differences in the illnesses spreading across schools. How do you plan to make sure that does not happen here in Arkansas?
By monitoring it. Yes, the school boards, the local superintendents, they have to make decisions as to what adjustments that they want to make. But obviously with the mask mandate staying in place statewide through March 31st, I would expect that they would keep that in place along with the social distancing requirements because that is important. But they will be able to work with the Department of Education and Department of Health if they need flexibility in some area. That's the benefit of having a guideline. Dr. Pfeffer, do you want to comment on that anymore? Okay. All right, maybe one more question.
Governor, this is Andrew with AP. I want to ask you a couple of things. First of all, on this, just to make sure I understand, so this would mean there's no limit on crowds or sizes of audience for events. Just wanted to clarify that. If so, how are you going to react if you see just a large number of large events happening after this being lifted? And I wonder if you could clarify on the mask mandate, how does that work with the lifting of restrictions on businesses? Does the mask mandate, are people still going to be required to wear masks inside businesses, at grocery stores, restaurants, or is it going to be up to the individual businesses now?
The mask mandate is in place, which means that you have to, if you cannot socially distance, you should have a mask on or a face covering. That's the current rule, so that does not change through March 31st, but we're giving people an incentive and a way forward that it will be lifted on March 31st if we meet these public health criteria that have been outlined, and that remains in place. All right, I'm going to be heading up to Northwest Arkansas to see a vaccination clinic today, which I'm very excited about. Dr. Romero, thank you for your leadership today, and Dr. Pfeffer, and they will be here if there's additional questions, but I'm going to have to take leave to hit the road on that. Thank you.
All right, you just heard from Governor Asa Hutchinson, where you did hear he is extending the public health emergency here in Arkansas to March 31st. That first went into effect on March 11th, and he made this announcement specifically today because it was set to expire tomorrow. And he says based on current data, this is still necessary. He also acknowledged there that our progress in reducing the number of our cases and the progress on the vaccine front. So that's encouraging to see. And he says that this mask mandate will continue through March 31st as well, but it very well could end on that date if things continue going in the right direction. You heard him there talking at the Capitol. He is now headed to Lowell, where a mass vaccination clinic is happening today. 3,000 vaccines are being administered today. He also wanted to point out that since we are going in the right direction, public health directives and mandates are now going to be guidance. So people are still going to have to wear their masks until at least March 31st. But for places like restaurants, gyms, salons, and other businesses, what they were mandated to do is now guidance. So Dr. Jose Romero is talking about the fact that we're keeping an eye on the variants that are spreading in other states, and it's possible it could be in Arkansas, but there's no evidence of that. So they're keeping an eye on that and may have to put more public health measures back in place if people start changing their behavior or these variants show up. So we're going to have a whole lot more later today on your 5 News at noon, but that's a summary of kind of what just happened. And we'll also be taking a look at what the governor said about schools as well. So we'll have a lot more later today on your 5 News at noon. That was Governor Asa Hutchinson giving an update on where we stand with COVID-19.